Cool. So I'm Hannah. I'm a massage therapist and yoga therapist at Equilibrio Massage. We're based in Bankers Hill in Bay Ho, and I specialize in prenatal and postpartum.
I'm Amber Rukai. I'm a licensed marriage and family therapist. I am a co-founder of Spark Mamas and also a therapist at UCSD Women's Reproductive Mental Health Program.
And I'm Chelsea. I'm also a licensed marriage and family therapist, the other half of Spark Mamas. And I specialize in working with pregnant postpartum women and women throughout all stages of the reproductive journey and parenting. Part of why, when we were talking in our pregnancy series, so much of it was postpartum planning, right? Because when everything is upside down and you're sleep deprived, what you think you may need on maybe say like day 5 or 6 postpartum might be very different than what you might need on day 7 or 9 when someone's planning to come over and drop off a meal. And so I think part of what we talked about in our last episode was this idea of practicing using your voice and asking for what you need and giving yourself permission to start to set boundaries. And I think this is where being able to feel like you can ask for what you need or express, I'd love to see you, but we're having one of those days, or we're having a really rough day. Would it be okay if you just left the meal on the doorstep and we can catch up at another time when I have more sleep, right? And so giving yourself permission to change your mind, giving yourself permission to get to know yourself as a new mom and get to know your baby, and being okay to let that be the primary need and things like visiting with friends and family be secondary, which I know is much easier said than done, but I think so much of that is the name of the game, right?
That totally makes sense. And it seems like to some extent there's like becoming comfortable with letting people down. Like it's okay to you're not going to be able to be everything to everyone, and some of the relationships are going to change, and maybe it's this period of time that they're changing within, but I could imagine that it's also like finding that comfort in the discomfort of like, I'm going to let you down right now.
Yeah, and I think that's part of like when we're doing the postpartum planning, we kind of do an assessment of their circle of support and take a look at who's kind of really going to be providing certain levels of support for them, and knowing the strengths and weaknesses in a way of each of those people. And then our expectations would match what that person can actually give versus saying, hey, I want you to ideally do this versus what I know you actually can do is X, Y, Z, and sort of asking that of them. And so we do a little bit of an assessment and analysis during the postpartum plan of what those support systems might actually look like so the expectations of those individual people can match.
That makes sense. So like really evaluating like how flexible this individual is in your life as well. So it's not just like all on you, but it's also being able to kind of understand where you sit and how this other person's flexibility may allow you to be more vulnerable and like set more clear boundaries. And maybe the people that aren't able to have that flexibility, maybe you're not relying on them like in the super early stages.
Yeah, and some people I think are helping, like to help in different ways. And some people are like the people who will come in and clean your house, and other people are like, I'm going to give you a gift card instead, and kind of help support you from that standpoint. And so I think that's part of it, is knowing what each of them can actually do or able to do, and ask for that level of support.
Mm-hmm.
That's awesome.
And I think kind of speaking to understanding what other people's strengths and expectations are, right? Or what you can expect of them. I think it's also being really realistic about where you will be at, right? So we know that women in those first, whether you look at it the first 40 days, whether we talk about it in that first month, but being really protective of yourself during that really vulnerable window, right? We can anticipate that most women will experience pretty big hormonal fluctuation, right? So we think that most women have about 80% risk, if not higher, of experiencing the postpartum, like the baby blues, right? So we know within that first 2 weeks, you're going to want to be really protective over yourself, because you can anticipate that your mood will be a little bit more vulnerable, right? And so also having expectations of how other people can support you, but also having those expectations of how you can support yourself, and knowing to be really graceful for yourself and not set up too many things in that first month postpartum.
Well, I think first and foremost, if anybody's expressing any thoughts of wanting to hurt themselves or their baby, and or even expressing any like passive thoughts, I think that that warrants a passive thought would be something more like, I'm better off dead, in that way. And so anything that's kind of around a safety issue and bringing up any of that, I would take that pretty seriously, and immediately have them talk to their medical provider, or if they already established care with a therapist, reach out to them in terms of that piece. You already mentioned postpartum psychosis. That the onset for that is typically within the first 2 weeks after birth, and so that's more like the peak period of that. And with that, we're looking for bizarre behavior, acting out of character. They don't seem grounded in reality, very disoriented, potentially manic in the way that they're presenting. Any bizarre behavior, we're going to want to make sure that we're kind of keeping an eye on that. Hopefully, we kind of talked about this in our previous video, but if anybody has a history of bipolar, we've already kind of done some preventative work in the pregnancy experience to see whether or not they're potentially at risk for postpartum psychosis.
So that's a really good question, Hannah, because I know that we have, research tells us that about 1 in 5 women will experience a perinatal mood or anxiety disorder. And we know that that number for paternal postpartum depression is about 1 in 10. And that number jumps to 1 in 2 if mom is struggling. So we know how mom is doing directly affects partner. And we know that partners also have their own vulnerability. So one of the things that I know Amber and I like to do is really have some level of dialogue, right? It doesn't have to necessarily be, I need you to fix it, I need you to take care of me, but having almost like a daily check-in. How you doing? What's, something like akin to like, what's your high? What's your low? Is there anything you need right now? And also encouraging your partner in that kind of daily check-in or weekly check-in of like, how do you also get support, right? And so, like you said, it's not necessarily the gestational parent's responsibility to do a lot of that caretaking, but it is both of the partners, responsibility to the partnership to make sure that they're taking the breaks that they need to care for themselves, right? Like we talk a lot about that oxygen mask. I've got to put my oxygen mask on first before my babies. And I think the same is also true for the support person, right? And so whether it's, somebody who has also come before you in parenthood or other resources, San Diego has a lot of great resources, and for family members, and specifically for fathers too.
Yeah, and I think it's a good idea too if the mom is already currently in therapy to invite her partner into a session during the pregnancy to plan around postpartum planning for both of their mental health and the family's mental health versus just only the mom. We like to have everybody come in within the first 2 weeks after delivery. If not sooner. Honestly, telehealth's one of the things that's afforded us this opportunity to see women a lot sooner than I think we were seeing before telehealth, just because it was hard for them to get out of the house and get moving and come to appointments. And so I really like to check on patients within the first week and definitely by the second week. Sometimes they're only ready to just do like a quick, brief 30-minute video visit, so they're just tired, but mostly I just want to have eyes on and assess and give them space. I think that's one of the things that was so important to us with Spark Mamas, is that we just felt like nobody was really holding the mom after they delivered. It was this experience of just delivering, having 10 months potentially of getting ready to birth the baby, and then delivering the baby and then going home, and there's just nobody taking care of them for potentially 6 weeks or 8 weeks, depending upon their recovery. And so for us to be able to have contact within those first 2 weeks feels really valuable for a lot of reasons.
Yeah. Part of it is we want to make sure that we're checking in, right? Sometimes it's also nice to be able to consolidate a woman's birth story, right? Mm-hmm. Sometimes being able to kind of document that, whether verbally with somebody or encouraging them to do that with their partner, so it stays fresh, can be a really helpful reminder. Also, I find that being able to, breastfeeding challenges often really occur early on. So being able to identify what are some of their challenges and how can we get them connected to the resources, right? Amber and I were finding in our work that we would meet moms, in places like 1, 2, 5 months postpartum when they could have benefited from that care. And so how can we get you connected to the resources that we need? How can we keep an eye on your mood, right? The mom's mood at 2 weeks baseline will likely look very different than 4 weeks baseline. So being able to document her mood throughout that period can be really, really helpful. Because we know that the sooner that we can intervene, the more that she can kind of get back to what she's, that postpartum period that she deserves.
Yeah, also too, I was thinking too, in the first 2 weeks, we do postpartum planning. We don't really know what kind of birth they're going to have. And so it gives us a chance to sort of reassess needs and support systems and sort of see how their recovery is going. That might change or alter sort of the support that they might need based off of how they're feeling or how they're experiencing things, or even the temperament of their baby. And like Chelsea mentioned with breastfeeding, and there's just a lot of things to assess that we would like to intervene and get them the support sooner versus waiting.
Like allowing that really hands-on ability to like interact with them and support them in a different way than like the planning period does. It's like I can support my clients in seeing a lactation consultant in their 3rd trimester and like having that support on hand, but like what does that experience look like fully, and like how are they handling it mentally, emotionally? It seems like then you're able to support them further and like almost more customized in reality, because it's like it's actually happening.
Yeah, one of the things that we know is that, postpartum depression often looks a lot like new motherhood, right? So a lot of new moms aren't going out of the house as much. They might be a little bit more with, fatigued, right? All the things that look like depression can also look like an adjustment to motherhood. And so if we wait, let's say 6 weeks, by that point, her mood, she could have isolated, she could have withdrawn, she might have, not been able to like attach or attune to her child in the way that maybe she had thought. And she might not be talking to anybody else. So the sooner that we can get in there and kind of either normalize the experience and support them with support a new mom with resources, and or help her identify that she might need a higher level of support, the better for both her and baby, and ultimately the whole family system.
I can imagine that normalization is like super helpful, because I think that, I mean, when you listen to birth stories, you hear very often of like this like instantaneous connection to your baby. And then you also hear birth stories, like not as few as you would think, but like you hear a good amount of birth stories where like not at all, didn't know who this thing was, like it was there, but I didn't understand like that it was mine, or like I didn't feel that instantaneous connection. And so I could imagine that ability to normalize that for someone and like support them in the process of like seeing if it comes, and like allowing them the space to go through their experience of it instead of this right away judgment of like this is wrong or something's wrong with me.
Yeah, I think they have, especially for first time moms, I think they have so many different stories, and they hear so many different stories about what they think their experience is going to be like. And so there's always this integration that happens for me between what they thought might happen and then what the reality actually is. And sometimes those things kind of match up and sometimes they don't. But either way, it makes space for them to be able to have some grief if they expected, if that's coming up, they hoped their birth to be and what it's not. And it allows for an integration into sort of like that transition of their own birth as well, which I think is just really valuable for them to have the space to kind of connect around everything that happened, especially if they've had a C-section or they've had any kind of traumatic birth. It's really important for us to attend to that, I think, as immediately as possible.
So there are various tools. I think Karen Kleiman, she has a great tool. It's called the Postpartum Pact, right? And it looks at, you can kind of go through together and identify what are the signs and symptoms that are particular to me, that is indicative to you that my mood may be struggling, right? So we can talk about that beforehand. What are things that would be helpful for me if my mood is struggling? How can I address it to you, right? So if I'm a new mom and I'm struggling and you tell me, oh, go take a break and leave the baby, I might interpret what you're saying as, I'm not a good mom. You don't want me to be with my baby. So if we can preventatively head into the postpartum period, having conversations about things that would be helpful. If you notice that my mood is struggling, I might be more, ready to hear them. Like, hey, I noticed that your mood is like, you're not as cheerful as you used to be, that you're having a really hard time leaving the baby with anybody. You told me that it might be helpful for you to call this girlfriend, right? That might land on me differently. So I definitely think those the psychoeducation and those proactive and preventative conversations are key. Again, what you're bringing up is this idea of like, maybe we haven't done that. Maybe we kind of didn't anticipate that. What do we do now? And I think inviting family members into sessions is always really, really important, right? Throughout your whole prenatal experience, most of the time the patient is the mom until baby's earthside and the patient becomes the baby, right? So having a therapeutic space to be able to talk about it and to identify that and to be able to get resources from a way of kind of not dissimilar to what we talked about. Like if I'm okay and you're okay, then the baby's going to be okay. Mm-hmm. Right. And so I find that more often than not, people are willing to be able to have some of those candid conversations, especially early on when we know that, you know, individuals and couples are so vulnerable.
Yeah, and I think piggybacking off of that, I think if we know for sure that someone has a history of having had a depressed mood before, we really, and or even anxiety or any mental health issue, we really encourage them to identify how that presented before and kind of how they can let their partner know what that looks like. So I do think it is different. There's some signs and symptoms that are different. I've had some clients where they say, when I get depressed, you'll know I'm really depressed because I start watching a lot of Netflix movies, or I shut down and I stop talking. Or other people say, I notice that I want to be taking a lot more baths and showers, or I cut down on my eating, or whatever it is. And it kind of gives people an opportunity to identify really what they notice about themselves and have that reflection in terms of that piece, and then to share that with their partners or their loved ones who are going to help support them, that, hey, these are some signs and symptoms that I know I'm not starting to do so well, and that I need to look out for me.
Mm-hmm. So identifying signs and symptoms and having conversations ideally in advance about like what this looks like, but also like kind of like Chelsea was saying, of like, how can you have that conversation in a way that actually feels supportive as opposed to feeling like shaming?
Mm-hmm. Hannah, I'm a big fan of safe words between couples, right? I love that. Like, especially when, you know, I have a couple who their code word was fuzzy bunny because she had fuzzy bunny slippers upstairs. And when she said that, it was like, I got to go put on my fuzzy bunny slippers. It was time to kick out whoever was visiting, right? And so having couples be able to engage in some kind of dialogue of like, I might be in a place, not only in between themselves, but with other people, right? Where I might need to be able to kind of take a step back and be more focused on myself than other people or even on you.
I love that's an awesome code word. It's like, I just need to go put my slippers on.
Yeah.
Everyone needs to leave my house.
Yeah. Code words work well too for in-laws that are coming over that we necessarily we need some space from as well. This will surprise you, but we like to do this preventatively as well. And to start having conversations about pretty early on of when we think we know they're going to be going back to work, and then kind of working our way backwards from that so that we have some time to start preparing for those transitions in terms of whether they have childcare set up, if they're having anxiety about leaving baby at all, then we start kind of practicing doing that a little bit sooner. If they're introducing a child care provider, we encourage them to do that also sooner, even if for it's a couple of like daytime visits where mom's getting some stuff done around the house and she's practicing leaving baby and getting a chance to kind of acclimate to the child care provider. Also, there can be making space for conversations around them feeling excited about going back to work and then feeling potentially guilty about that. Why that is and sort of where those feelings and that narrative might be coming from as well for them in terms of their excitement about going back to work, but also feeling bad about that. And I also like to have conversations with them to talk to their partners about how division of labor and roles will shift in terms of maybe mom has been at home historically and she's doing a load of laundry and getting dinner prepped and taking care of baby, but now when she goes back to work, she may not be able to do those things. And so how does that shift look like in your family system with that transition back to work? The other thing for me is I always encourage families, if they can, to try to transition back slowly and to not kind of go in guns a-blazing with like, yes, I can do all of these things, and to sort of give themselves permission to ease into that transition back, and to not take on too many things, because it takes a little time, especially if they're pumping when they transition back to work, to get sort of used to that and acclimated, and making sure they have a space actually for that as well, I think is a preventative measure that I wish a lot of companies took a little bit more seriously, that sometimes they don't always have a space for that if moms are transitioning.
Yeah, so just to kind of reiterate some of the things that Amber kind of said is giving yourself a long runway, right? Of like, how do I kind of prepare? Some of that is like practicing pumping. Some of that's making sure your baby, if you are breastfeeding, can adjust to bottle feeding, right? Because that can be really, really stressful of knowing that your baby's not eating while you're gone. Also, I encourage families to think about how they stagger support, right? It's oftentimes people want to front load, I want to see the new baby. And what would be most helpful is having someone to kind of bridge that gap when you transition back. And maybe you say, like, I don't, I prefer to keep my child at home for the first 6 months versus daycare. So if you're going to go back to work at maybe month 3 or 4, piecing together some family support, and also encouraging partners, if they're eligible for paid family leave, to use that time in that transition back to work. Not again, it's not always available to some women, but having a graduated return to work can be really, really helpful. Starting, protecting, maybe even just doing like a 3 or 4 day work week before starting out at a full 5 day work week, if that's what your schedule is, and kind of building as you go. I find that if you can give yourself that space, if possible, to kind of reconnect to work in a way that feels like it's hard. You're essentially leaving and you're coming back sleep deprived with another human being, and you've never worked before in that way. And while a lot of moms might say like, oh, it feels really good to be connected to something other than motherhood, I also know that sometimes moms feels like I'm failing, right? Like I'm failing as a mom, now I'm failing at work. And so if you can give yourself some time, I think it can make for a very different experience.
Mm-hmm. Chelsea, it made me also think just about kind of using this as an opportunity. When the first month, I encourage people to kind of outsource some things to give their family a chance to kind of just adjust, whether that's giving themselves permission to have some meal delivery service or increase support with chores around the house, just so that they have a minute to kind of get adjusted. I think those transition times from work to home with picking up baby and kind of into the house can be really overwhelming, and dinner time is one of those times that tend to cause a lot of stress for families. And the other thing too I was thinking about was giving them some time to practice, especially if mom is the only person at this point who's been doing nighttime feedings or getting up at nighttime, to practice making sure that other people can help support at nighttime, so that when mom gets ready to go back to work, she's not completely sleep deprived, and that there's been some practice at other people helping feed baby for middle of the night feeds.
Those are awesome tools. Those answers reminded me when we were talking about in one of the previous ones about like preparing like children at home and like yourself for that transition. It felt like a lot of that same, like, we're going to practice these things and we're going to do them slowly and start to integrate them and see how you do with like little bits of it, and then being able to kind of move into the full transition.
Right.
I don't have any other questions right now. I mean, I'm sure I could think of some, but I don't have any more questions right now. Did you guys have anything else that you felt was really important that we didn't go over?
No, we covered a lot of the things. I mean, I think, we have a great postpartum planning tool. I know we mentioned it in our last video, but we're going to be hosting that on our website soon. So we look forward to being able to share that with our Spark Mamas followers. But really, when it comes to some of those areas of postpartum, that postpartum support, is we just really want to encourage moms to seek out help sooner than later, rather than later, right? I think a lot of moms will kind of put themselves, like, it's a fascinating transition to observe as a therapist of how many things moms are willing to do, right? And I'm sure you see this, Hannah, of like taking care of yourself because the baby's in utero. So taking care of yourself physically, taking yourself emotionally, choosing what you put into your body. But once baby is earthside, all of those resources tend to go to baby. And so giving yourself permission to continue to take care of yourself in that same way that you did before, whether that's getting your postpartum massage, whether that's continuing to make sure that you're, nurturing your depleted body, and asking for help.